Hello, dear learners. I am Ranjeet Ade, lecturer, Geeta Devi Khandelwal Institute of Pharmacy, Akola. Feel very happy to welcome you all on this online model. Today we are going to discuss drug dependence and drug abuse, part 1. This chapter we are going to cover in three parts, so from which today we are going to cover part 1. How are you, friends? Hope you all are well and safe at home. Utilize your valuable time for the preparation of annual examination, and being a pharmacist, guide other people's and your neighbors how we can protect ourselves from the infection of coronavirus. So stay at home, stay safe, stay happy and stay fit. Dear student, today we are going to discuss the topic drug dependence and drug abuse. The learning objectives of our today's topics are: at the end of this topic we are able to define drug dependence, drug addiction, drug habituation, drug abuse, drug hallucinogen and drug tolerance. Describe sign and symptoms and treatment for drug abused patients. So these things we are going to learn in a part 1. So first of all we discuss about the definitions. Drug dependence, as the name indicate, that patient is get depend upon the drug. So because of that drug dependence is occurred. Means so many times peoples are administered something or some substance. After taking repeatedly or continuously, these drugs may produce the psychological or physical dependence. Means if these peoples are stopped to taking this particular drug, they feel a discomfort or they may feel uneasy. So for that, means that indicate that people or the person is get depend upon the drug. So let's see the definition. According to the WHO, drug dependence may be defined as it as a state of psychic and also sometimes physical, resulting in which the users has a compelling desire to continue taking the drug, either to experience its effect or to avoid the discomfort of its absence. Means people are compelling to desire to continue taking the drug. Why? Either to experience its effect or to avoid the discomfort of its absence. Why? Because the drug are produce the psychological or physical effects or dependence. If they are take if they are stopped to taking these drugs, then these drugs are produce some effects over the this produce the effect psychological or the physical effects over the health. Then drug addiction, it is a state of chronic or periodic intoxication resulting from repeated consumption of drug. So many peoples are administered some compounds such as the alcohol. This is the general example. So many people consume alcohol, and if they are repeatedly consume this drug, alcohol contain ethyl alcohol, so they are get depend, means psychologically they are get dependent, physically and psychologically they are get dependent over this alcohol. If they stop to taking this alcohol, that may produce the physical effect as well as the psychological effect. Patient may feel depressed, patient means patient may feel discomfort, then patient trimming is takes place, palpitation may takes place. So that type of various effects, and again hangover is also produced. So that type of various effects are produced within in the body of patient. So the psychological effect as well as the physical effects are produced by this drug like alcohol. then opium, opiates, cocaine, morphine, heroin, etc. So because of that, the peoples are get addicted. Then drug habituation, it is the state of resulting from repeated use of the drug. Means the people are taking a drug to feel their effect or to avoid the discomfort repeatedly. Then they are get habituated with this particular substance. This is the psychological dependence. Drug addiction is called as the physical dependence and drug habituation is called psychological dependence. Here we see the example, very small example for the drug habituation. So many people are taking a tea early in the morning. Tea contain a caffeine. So to feel a good or to feel a fresh or to start the day, so many people are taking a tea. So this is one of the example of drug habituation. Then drug abuse. Drug abuse is defined as the consumption of drug apart from the medical need or in unnecessary quantities. Here we can see the examples such as if any people administering the cyproheptadine to produce the appetite or to produce the hunger or to produce the drowsiness or to induce the sleep. But this cyproheptadine actually developed as an antihistaminic drug, but their adverse effect is this produce the hunger as well as the drowsiness. So many people are utilize this drug without a medical need to produce the drowsiness or to induce the sleep or to induce the hunger. So this is the drug abuse. So likewise, the peoples are using a number of drugs such as the codeine phosphate. This drug is generally prescribed for the treatment of dry cough, but so many peoples are used to to feel their experience their effect or to produce the drowsiness, etc. Hallucinogens, these are the drugs or the agent or the substance that act on a central nervous system to produce a state of perception or of object with no reality or of sensation with no external cause. Means simply peoples are goes in a dreamy life without any reality. They feel something, they have the sensation, these people goes in the perception. They can able to feel like a superman's. So this is the hallucinogen. So these are the drugs or the agent or the substance that act on a central nervous system. Generally all the drugs which are produce the dependence, they are act over the central nervous system to produce a state of perception of object with no reality or of a sensation with no external cause. Then drug tolerance. Tolerance is a psychological state characterized by the decrease in the effect of a drug. Example given: analgesia, nausea, or the sedation, particularly narcotic analgesics. Okay, if we administer the small doses of narcotic analgesic continuously, then after some days these people are not, means this quantity of drug is not able to produce the analgesic effect. We have to increase the dose. Okay, then with a chronic administration, it signifies the decreased response to the effect of a drug necessitating ever larger doses to achieve the same effect. Simply we can see the example for drug tolerance is to produce the sedation, or if we administer the uh, clonazepam to induce the sleep, or diazepam, then these peoples are, means if we administered a 25 mg of dose primarily, then 25 mg of dose of clonazepam is able to induce the sleep. But after passing some days, after passing some months, that much drug is not able to induce the sleep. So for that we have to increase the dose. This is the drug tolerance. Then what are the criteria for the substance drug abuse? Primarily people's craving to use the substance. Then after that they are wanting to cut down or stop but not manage to, as they are get depend or maybe addicted or maybe habituate with this drug. So that's why they want to stop to taking this drug, but they have to take either to experience its effect or to avoid the discomfort after stopping this drug. Taking the substance in a larger amount, as this produce the tolerance for the longer than you are meant to. Then neglect other parts of your life because of substance use. Socially these peoples are get avoided. Then continue use even when it causes the problem in a sexual relationship. Then using substances even when it puts you in a danger that may can damage the vital organs of the body. Then general sign and symptoms of the abuse: it produces the drowsiness, then loss of appetite may be produced, anorexia, rashes over the body, weight loss, hair loss may be takes place, joint pains, hallucination, perception, low libido, liver kidney damages, dysfunctioning may be takes place, dizziness, memory loss, paralysis, death can be also takes place because of the drug abuse. So these are the general signs and symptoms of the drug abuse. So now we'll see the treatment of drug abuse. The treatment aspect of drug abuse is: first, detoxification; second, care of withdrawal symptoms; third, rehabilitation, that is the punarvasan; then the fourth, government support. Detoxification, first of all, adverse effect results from the drug abuse with a specific drug are treated by hospitalizing the patient. The use of such drugs are stopped immediately. Means first of all we have to detoxify the drugs. So first step is detoxification. Firstly, adverse effect result from the drug abuse with a specific drug are treated by hospitalizing the patient. The use of such drugs are stopped immediately. Then care of withdrawal symptoms: after withdrawing these drugs, they are produced various psychological or physical effects which are treated by giving a medicine like analgesics, antiemetics, multivitamins depending on the condition. Then treatment, then rehabilitation. This is the part of long-term treatment for those patients who need a moral support, motivation, psychotherapy, particularly victim narcotic drug or the alcohol. So self-help group like a narcotic and alcohol anonyms, these groups have to develop, and these peoples have to rehabilitate in the normal society. Then government support. So for that, government is also provide the support, as it is not a direct part of the treatment, but by controlling the traffic of drug under the Narcotic Drug and Psychotropic Substances Act 1985 can stop the population from getting addicted. So this is very important for the annual exam, so prepare well. Commonly abused drugs are: the drug of abuse are categorized as follow. First, narcotics such as the opiates, opioids, morphine, heroin, pethidine. Then central nervous system depressant, alcohol, barbiturates, sedatives, central nervous system stimulants, tobacco, caffeine, cocaine, hallucinogen, LSD, cannabis. Then fifth category is inhalants like hydrocarbons, acetone, petrol, etc. Then abuse of opiates or the opioids. These classes of drugs are commonly used by the addicted person. Heroin and brown sugar are choice of drug. A dose of 25 mg of heroin effect lasts for about 4 hours. So repeated administration is needed to avoid the psychological and physical discomfort. Example given: codeine, fentanyl, hydrocodone, methadone, morphine, oxycodone, oxymorphine and tapentadol. So these are some of the examples which are mentioned into the window. So dear students, in next part we'll discuss the abuse of opiates, their treatment, difference between them,